indicate increasing transmission in recent weeks. Unfortunately, we're now beginning to see rising severity trends as well. While some degree of increased transmission was expected, we are once again reminded that we need to maintain a vaccine plus approach with a layering of precautions to help lower infection rates, protect vulnerable populations, and dampen the impact on our health system. Bien qu'une certaine augmentation de la transmission ait été prévue,
while some degree of
la
increased
situation nous
transmission was
rappelle
expected,
encore une fois
we are
qu'il
once
est
again
essentiel de maintenir
reminded
une
that we need
approche
to maintain
vaccin
a
plus
vaccines
et de
plus
prendre les
approach
précautions
with
appropriées
layering
pour
of
aider à
precautions to
réduire
help
les taux
lower
d'infection,
infection
à
rates,
protéger les populations
protect
vulnérables
vulnerable
et à atténuer
populations,
les répercussions
and
sur le
dampen the
système de santé.
impact on the health system.
Up-to-date vaccination continues to be the strong core of this strategy. Experts across Canada and worldwide continuously monitor safety and effectiveness data and adapt vaccine recommendations to provide people with the best possible protection over time, and as the virus continues to evolve. Reassuringly, the latest evidence tells us that getting an mRNA COVID-19 vaccine booster dose can provide longer lasting protection and better effectiveness, even if you have been previously infected. This is why Canada's Chief Medical Officers of Health are urging people to keep up to date with all recommended doses of COVID-19 vaccines, including booster doses. Because the Omicron variant is immune evasive, 2 doses of the COVID-19 vaccines offer less protection against this variant than previous variants. The good news is that boosters can help increase antibody levels that wane over time after the second dose. Although vaccine effectiveness against infection decreases over time, evidence shows that 2 doses of mRNA vaccines generally maintain good effectiveness against severe outcomes across variants. And a booster further increases vaccine effectiveness to over 90% against severe outcomes. En raison du fait que le variant Omicron a tendance à échapper au mécanisme immunitaire, 2 doses de vaccin contre la COVID-19 protègent moins bien contre ce variant-ci que contre les précédents. Heureusement, bien que la quantité d'anticorps diminue avec le temps à la suite de l'obtention de la deuxième dose, les doses de rappel contribuent à augmenter le niveau d'anticorps. Bien que l'efficacité des vaccins contre l'infection diminue avec le temps, selon les données probantes, 2 doses de vaccins à ARN moléculaire ont une bonne efficacité contre les conséquences graves de la maladie, quel que soit le variant, et une dose de rappel fait passer l'efficacité du vaccin contre de telles conséquences à plus de 90%. The National Advisory Committee on Immunization has updated guidance on the use of first booster doses, which they strongly recommend for adults aged 18 years or older and adolescents aged 12 to 17 years who are at higher risk of severe outcomes or exposure. In addition, NACI recommends a first booster dose may now be offered to anyone aged 12 years or older in the context of heightened epidemiological risk. Given our immune system is less able to maintain robust protection as we age, I would especially urge all people aged 50 years or older to get booster doses as recommended, with the first booster dose at least 6 months after the primary series. At this time, NACI recommends that second booster doses be rapidly deployed and prioritized for those who are expected to benefit the most, namely residents of long-term care homes or other congregate living settings for seniors, as well as seniors aged 80 years or older living in the community. NACI also recommends that jurisdictions may choose to offer a second COVID-19 booster dose to adults 70 to 79 years of age living in the community. There is still a lot we can do to dampen down the current trajectory. We know that using personal protective measures like masking helps reduce transmission. Likewise, getting a booster dose doesn't just protect you against severe illness, it also provides a level of protection against infection, which in turn helps to reduce transmission. The more of us getting up to date with our COVID-19 vaccines with booster doses, the greater the effect to lessen the overall impact of the wave, which can help protect vulnerable populations and preserve healthcare capacity for everyone. So getting a booster dose matters. And I urge every eligible person who hasn't yet updated their vaccinations to check in with your health provider or local public health authority to see what additional doses you're eligible for. Nous pouvons encore agir de multiples façons pour atténuer la trajectoire actuelle. Nous avons que les mesures de protection personnelle, comme le port de masque, aident à réduire la transmission. Dans la même veine, recevoir une dose de rappel nous protège non seulement contre les conséquences graves de la maladie, mais aussi contre l'infection, ce qui aide à réduire la transmission. Plus nous serons nombreux à être à jour dans nos vaccins contre la COVID-19 et nos doses de rappel, plus nous serons en mesure de réduire l'impact global de la vague, ce qui aidera à protéger la population vulnérable et à préserver la capacité du système de santé pour tous. Il est important d'obtenir une dose de rappel et je conseille vivement à toutes les personnes admissibles qui n'ont pas encore mis à jour leur vaccination de consulter le professionnel de la santé ou l'autorité locale de la santé publique pour connaître les doses additionnelles qu'elles peuvent recevoir. It is not too late to get up to date with COVID-19 vaccines now. However, with disease activities very high and still rising in many communities, it's important to use other precautions like masking, improving ventilation, or opting for outdoor settings, and staying home if we have symptoms or have tested positive. As Ramadan continues, and with Passover, Easter, and other long weekend celebrations and opportunities to gather before us, let's keep doing our best to protect each other. While uncertainties remain, we also need to be prepared for resurgence of COVID-19 in the fall and winter, and the potential need for additional COVID-19 boosters at that time. Thank you. Merci. Megwich.
We'll now start with the questions. If you have a question, please raise your hand. Alors, on va commencer par Laura Osman, the Canadian Press.
Canadian Press.
Good morning, Dr. Tam. You've spoken in the past about the need to empower people to be able to make their own public health decisions in the context of restrictions being lifted. We're hearing from people that they feel that they don't have the tools to do that they don't have the information to know about their local sort of epidemiological situation and assess their own risk. So what more needs to be done to help give them the tools to actually empower them to make those personal decisions?
Yes, thank you for that question. That's really important. Right now, though, let me just emphasize, all across Canada, doesn't matter where you are, it's very likely that Omicron variant, the BA.2 sublineage, is spreading quite widely in your community. So doesn't matter where you are in Canada right now, I would advise getting that booster shot and masking and improving ventilation. So I think that should be helpful to everyone trying to figure out the risk assessments. We have developed some tools for personal risk assessment, depending on your own medical and underlying conditions or age and what kind of setting you're entering into. However, I think your point is well taken, which is we need to continuously provide some of the epidemiologic information that we know about. So I think as the number of tests are continuing to increase right now, I think not unexpectedly because the curve is going up. There's more people being tested. So we can still trend the upward rise of that curve, even if we're testing less. So still keep looking at that epidemiologic curve on the cases and the hospitalization and the deaths in your community. But more and more local communities are also communicating their wastewater signals, for example, as a supplementary signal. And you see that all across the country. At the national level, we are trying to provide that information about the wastewater testing sites on a website. But I know we can do more as we are beginning to escalate the benefit of this tool to actually try and provide that in a more consistent basis to everyone in all communities. Wastewater data right now covers about just over 60% of the population. We're aiming to do better to go with trying to get to that 80% coverage. But it's not the easiest thing to interpret. But I think you would appreciate that wherever you're living, for example, I'm in Ottawa, our local public health officer is communicating these signals in a real-time basis to the population. So I still urge everyone to listen to your local public health authorities.
Thanks so much for that. Switching gears just slightly, several experts we've spoken to say the approach to prescribing Paxlovid has been a bit of a patchwork province to province. And we're wondering if the Public Health of Canada intends to do some kind of implementation study and what you would hope to learn from something like that.
Really great question. So we have, at the federal level, of course, facilitated the purchasing of Paxlovid and distributed, I think to date, 150,000 or thereabouts courses to the provinces and territories. They are trying to figure out how to deploy because the drug has to be provided to high-risk populations within 5 days of the initial onset of illness or symptoms or test positivity. So I think my message to all Canadians who may be in high risk, such as the immunocompromised, figure out in your community right now how you can get access to that medication should you need it, because it is a bit different across different areas of Canada, and including some provinces enabling pharmacies to prescribe, and others are using a more centralized distribution mechanism, and also using physicians who normally look after those at higher risk through those networks to enable access. But it is a bit different across the country. But I think as a personal protective measure and getting prepared, try and figure this out now before you get ill, I think is really important. But we are actually collaborating the provinces and territories, but also researchers in looking at the effectiveness of the Paxlovid medication as an outpatient measure, because the Health Canada authorization and the clinical trials were done in unvaccinated populations. So we want to know what additional benefit the drug has for the vaccinated population, which is the majority in Canada, of course, as well as providing the drug to the unvaccinated population who are at the highest risk. The feasibility and the practicality of operationalization of this deployment is not simple. But we are trying to study it and see if we can translate best practices across jurisdictions, including how do you enable pharmacists to give out this drug. So yes, we are going to be looking at the best practices for deployment.
On va maintenant passer à la question de Mylène Crête de La Presse.
Mylène Crête, La Presse.
Hi, I was wondering, how efficient is it for provinces to recommend the use of wearing a mask as opposed to making it mandatory?
Yes, and thank you for that question. We are in a difficult period. We call it the transition period. Not only is the virus trying to find its way in the world and transitioning, and we're transitioning from what I would hope is the acute crisis phase, but into the sort of somewhat unknown, uncertain territory of viral evolution. We should keep up with these layers of measures. I think trying to continue to observe the impacts of requirements versus recommendations is very important. I think for now, everybody should be layering on those protections on top of the vaccines, including the mask. It sometimes takes the guesswork out of people, I think, on a practical basis if there was a mandate. But I think all public health authorities at the moment are trying to shift the paradigm into making sure people learn these good habits and be able to employ them. But I think my message is also not just protecting yourself, but please try and remember there are others in your community who are more at high risk of this virus, and you wearing a mask or getting vaccinated helps them. So I think that's a really important message. I don't know, I think in different communities, depending on the context, the social cohesion and other variables, each of those policies might work better under different circumstances. But I think people are keen to see and trust that the population are able to employ those layers of protection.
Do you consider that we are now in a sixth wave of COVID across Canada? And as for the vaccination for the booster, for instance, in Quebec, only 53% of the eligible population has received it so far, even though it's been available since January. So do you see that there's less of a concern in the population about getting the booster doses?
Yeah, this is the really important question, and is the main message that I have for everyone today, which is to go get boosted, certainly for the 18 plus, because we are experiencing the upward surge of cases right now. I think it's semantics as to whether you call it the sixth wave or not, but there's an increase, which is being seen in most areas across Canada. Some provinces didn't really see much of a wave at the beginning of the pandemic, and they're experiencing the most important resurgence in the last month since Omicron. This is an Omicron wave, we believe, is really taken over by the BA.2 sublineage, which at the last analysis, we are now at certainly over 60% or more of the identifications and the sequencing are now BA.2, which is even more transmissible than BA.1. So we are seeing that resurgence, whether you call it the sixth wave or however many waves there is in your local jurisdiction, it is a resurgence. And that is why it's important to get that booster now. I think that as the Omicron wave began to descend, I think people felt that maybe they don't need that booster. And I think we're strongly recommending that right now. Some people also think that, well, I just got an infection, so maybe I don't need a booster. We are recommending it. NACI, the National Advisory Committee on Immunization, is still recommending that even if you've been infected, you should get a booster, but you don't really need to get it until about 3 months out from your documented infection. So I think some of those factors may be playing into why we are not getting the level of boost that we're seeing. I also recognize that at the time of the initial effort in doing the boost campaign, it was in a very difficult period of time where vaccinators were getting infected. We had a absenteeism from the public health and health system. So it's not easy to increase access and making sure vaccines are accessible to all populations. But I think I've seen local public health right now trying to mobilize clinics, trying to get Toronto, for example, deploying vaccines in different spots in the city to try and improve access to the booster. So that's always important, I think, in upping our booster rate. So this is our, I think, collective effort right now to get the boosters in as the wave is increasing.
Prochaine question, Jamie Moracher, Global.
Hi, Dr. Tam. Can you hear me okay?
Yes, thank you.
Okay. My first question for you is, what is your recommendation as we head into the long weekend? I know, this is the third pandemic Easter that people have celebrated. Last year, the recommendation was, kind of stay separate if you can, do a virtual hosting. What's the official recommendation this year?
Yes, and I think get your booster. I hope you've already got it, but this can be a reminder. I think many of the religious observations over the weekend in any religion is promoting compassion and protection of each other and community. All of the religions promote that. So I think as part of that, please go and get up to date with your vaccination and wear a mask. Anywhere where you're going into an enclosed environment with people who are not in your household. I do think that people want to gather. Try and make sure that you can improve the ventilation as much as possible or gather outside, but you can still celebrate and have opportunities to do that in a safer way. We've all learned those habits and behaviors, but there is a risk. So if you were at a very high risk, you may want to layer on other protection measures like getting a rapid test. There should still be rapid tests available in the communities. I know that the federal government has continuously deployed these rapid tests. They have their limitations too, but I think they do help if you get a positive test to stay home and not spread it to other people. So I think with all those measures, try and celebrate in as safe a way as possible.
Thank you. And then my second question to you is, do you have any concerns about the new variants that we're seeing? So XE, which we know is already here in Canada, and now BA.4 and BA.5, and have the latter been detected in Canada? Do you know?
Mm-hmm. Yes, it's very important through the global genomic sequencing network to keep track of the variants. I think all of the above that you've just talked about, BA.4, 5, there's a BA.3, of course, are Omicron derived. And some of the recombinants that starts with the X, so XE, are also a recombination of BA.1 and BA.2. The latter, XE, is a combination mostly of the spike protein of the BA.2 variant, but with genes from BA.1. So they're an evolution of that Omicron family tree. And we do expect that to happen because there's a lot of transmission of this virus all over the world. I think XE got some attention because there's evidence of some community transmission in some countries, such as the United Kingdom. So we're watching that one really carefully. You mentioned that we had some detections. Some of those sequencing are not always easy to decipher or classify. So that is a shifting landscape, but we may have a few, but I think the National Microbiology Lab is saying that we, in fact, probably none of them truly fit the XE sequence definition. So we will revise that as we get more information. But all to say is that we're watching out for those signs of whether these variants are more transmissible, but in particular, whether there's any shift in the severity of the impact of those variants. At the moment, we have not detected any BA.4 or 5 in Canada.
Prochaine question, Michel Sabat, La Presse canadienne.
Michel Sabat, Presse canadienne.
Bonjour, Dr. Tam. Devrait-on élargir l'accès aux tests PCR étant donné le déferlement d'une sixième vague dans plusieurs provinces? Et sans cela, saisit-on vraiment la portée de la recrudescence actuelle?
Oui, même avec diminution de tests dépistage et de tests PCR, on peut apprécier une augmentation. C'est évident. Donc, on a fait assez de tests pour suivre la trajectoire de cette vague. Mais il y a beaucoup de cas qui ne sont pas détectés, c'est sûr, au Canada. Avec la surveillance de séroprévalence, the des anticorps dans la population.
With the number of antibodies that are
on a détecté
levels,
juste
une
petite
we have
partie de cas jusqu'au
just
maintenant,
a small range
durant
of this
le vague
at the
de
time
Omicron.
being, with respect to the Omicron wave.
Je suis
I am
très content de voir
very happy to see
que quelques provinces ont augmenté le test de PCR maintenant. Ça, c'est important.
That's important.
Le trajectoire
so that we can follow the trajectory, which is accelerating.
Another enjeu est que on ne capture pas le test rapide, mais il y a quelques efforts dans les municipalités
but it's up to the municipalities
essayer
to try
de capturer le test rapide aussi.
These rapid test results as well.
But it's evident that there is an increase. Le taux de hospitalisation est en train d'augmenter un peu aussi.
On the rise as well.
La modélisation n'est pas assez efficace qu'avant.
Is
mais
effective.
En général,
but generally speaking,
la modélisation,
modeling.
How do you say forecast? In taux d'hospitalisation un peu
with respect to hospital rates,
le première vague de Omicron.
Is showing that there are
but we cannot be
fewer hospitalizations than under
we
the first wave.
We are seeing the hospitalizations going up in some jurisdictions. ICU admissions haven't really seen much of an uptake right now. We hope that's the impact of the vaccinations. So that's another reason that we are promoting the booster. The dose de rappel est très important maintenant.
Booster doses are very important
et puisque
right
vous en parlez, devrait-on justement tenir un registre dans chaque province des résultats de tests rapides? Et par ailleurs, l'analyse des eaux usées devrait-elle ne plus seulement se faire que dans les grandes villes de certaines provinces et où au pays devrait-elle se faire dès possible?
But should it be done elsewhere as well?
Oui, c'est difficile de capturer toutes les tests rapides.
All of the test results from rapid tests.
Surveillance avec des lots utilisés.
That is being used.
C'est important maintenant.
It's very important.
Les lots usés. Il y a une couverture après plus de 60% de la population.
More than 60% of the population
plusieurs réseaux
is being covered by wastewater testing.
So the wastewater surveillance is being done right now that covers about 60% of the population, including some in the north that has been utilized very effectively, like the Northwest Territories. So I think we're trying to continue to expand that. That 60 to 80% is not always easy. Those tend to be communities that are smaller. But I think we will keep working at that and in support of the different networks. But I think what is important, as some of the journalists have pointed out today, is try to make that data more evident, more available to the population. And that complements, I think, the PCR testing and other aspects of surveillance.
Next question, Dylan Robertson, Winnipeg Free Press.
Hi, Dr. Tam. Thanks for taking our questions. I was wondering about if there was ever an attempt to register rapid test data among the medical officers of health. We know that the Northwest Territories asks its citizens to report the results of rapid tests, and I'm just wondering if there was ever a discussion at the table of chief medical officers to have other jurisdictions do this or to set up any kind of a federal program like that.
Yeah, I think we have discussed this and sharing some experiences and best practices. So I think jurisdictions are continuing to examine that as another potential surveillance vehicle. So I think we are certainly interested in innovations in that space. PCR continues to be important. So even with a drop in testing, And because it's more targeted towards the higher risk population, we do need to have more representative testing wherever possible. So I think that should continue to be encouraged. I am seeing some increase in PCR testing just in the last week or so, probably as the curve of the Omicron variant is on the upward trajectory. But we are doing enough for us to perceive at the national and maybe at the sort of provincial level the trajectory of the shape of that curve. So that's still important. I think the wastewater is a very interesting, innovative, and important tool because it is going to be more representative. It doesn't matter who is living in that community, in those communities, but we will get a better idea. So I think local authorities are just beginning to get used to how to interpret, how to communicate that data. So I do think that is, even worth even more of an effort than trying to capture individualized rapid test results. And people would do more than one. And, how do you capture all of those tests is sometimes difficult to work out, but that doesn't mean we shouldn't try and have a go and see what innovation and what best practices can be shared. So I will certainly continue to do that with my colleagues at the Special Advisory Committee.
Thank you. And could you please expand on your point about social cohesion when it comes to mask mandates versus suggestions? Because you mentioned that this plays out differently in different contexts. You'd mentioned social cohesion. I'm just trying to wrap my head around, if you might have an example or if you could just expand on that.
Well, I think, first of all, I want to thank everyone living in Canada because it is with collective community spirit and the spirit of not just protecting ourselves, but protecting others that we've done, I think, actually relatively well. We always do better in Canada. We could not have done this without the community coming together. And I think that's an important aspect of how you do public health policies going forwards. And I think giving people the data and the information to add the layers of protection is important. Right now, I think everybody should think about getting the booster and the masking and improving ventilation for themselves and for others. So that's what I mean by social cohesion. I don't think it's necessarily helpful to be divisive in our this discourse. I think everybody deserves to be heard, but I think from a public health perspective, it is clear that vaccines are effective. You should get boosted. You should wear a mask. So as much as possible, people should do that. One aspect of social cohesion is that it's quite difficult for the public right now because I think people, at least I've heard anecdotally, people wear masks when it's your local jurisdiction doesn't require it. You're wearing a mask and people are giving you comments. That's not appropriate. We need to support people in being able to do that if they want to. And I think that's one aspect that we need to work together on. There's probably some very good reasons why someone wear a mask, even if others don't. So support them in doing so.
Prochaine question, Laurence Martin, Radio-Canada.
Oui, bonjour, Dr. Tam. J'aimerais savoir si c'est possible de clarifier en français. Parce que c'est toujours pas clair pour moi. Est-ce que oui ou non, on est dans une sixième vague? Et est-ce que vous avez l'impression que les provinces en ce moment prennent suffisamment de précautions, je pense aux masques par exemple, pour contrer cette vague?
Oui, ça dépend de quel endroit. Oui, on peut dire que nous sommes dans une sixième vague en général au Canada. Parce qu'il y a une augmentation d'activité de COVID-19 partout.
COVID-19 activity everywhere.
Donc, C'est vrai.
It's true.
On peut dire que nous sommes dans la sixième vague.
We are in the sixth
c'est
wave.
Juste la terminologie, c'est important que tous les Canadiens apprécient que le niveau d'activité de COVID-19 est en train d'augmenter.
What's going on with COVID-19 in their region?
Pour votre deuxième question, c'est très important d'obtenir votre dose rappel
to get your booster dose.
Et en plus,
and in addition,
j'aimerais dire vaccin plus. Tout le monde
I would really
les
say that the vaccine plus approach
comme le masque.
Is very important.
So it doesn't
Masking
matter maybe which jurisdiction you're in or whether it's mandated or not. It's just a really important thing to do. And donc, c'est une période difficile de transition.
This is a very difficult transition period.
La communauté et les provinces et le territoire. C'est pas facile.
It's
mais
not
le message est clair.
But the message is clear.
Même s'il n'y a pas de mandat,
if there is no mandate,
c'est toujours important de porter le masque.
Still important to continue masking
la dose de rappel.
And get the booster dose.
Excellent. Merci pour la réponse en français.
Thank you for your answer in
Deuxième
French.
question, est-ce que vous pensez que donc, si on est rendu dans une sixième vague, avec toute l'expérience qu'on a acquise depuis 2 ans, est-ce que vous pensez que c'est normal que la plupart de la population au Canada n'ait pas accès en ce moment à un test PCR?
Have access to a PCR test.
Oui, c'est important d'obtenir assez de tests de PCR.
Get enough PCR tests
la surveillance,
for surveillance purposes,
pour apprécier la tendance, la trajectoire
to understand the trajectory of the wave
d'épidémie. Ça, c'est très important.
That's
pour
very
les individuels,
for individuals,
surtout pour les personnes qui sont plus à risque de COVID-19,
at risk for COVID-19,
sérieuses.
C'est important d'accéder aux tests de PCR. To get access to these PCR tests. But
en plus d'accès de tests antigènes rapides.
We do have access to the rapid antigen tests. The two tests are complementary.
On a besoin de deux.
So we need these two tests.
Maintenant, avec une augmentation de vague,
with the increase in
selon moi, c'est important d'augmenter l'accès de PCR. Pour la population.
It will be important to get PCR tests.
Peut-être quand la vague diminue, c'est pas nécessaire si on a
maybe it won't be so necessary.
Un bon système de surveillance avec
a good surveillance system.
Les dépistages qui sont plus représentants de la population.
And the testing tests that are and the testing.
Next question is Rachel Hans.
Hi, Dr. Tam. It's Rachel Haynes from CTV. Can you hear me okay?
I can.
Perfect. Thank you so much. I wanted to ask you very similar questions to what some of my colleagues have been asking about provinces and if they should be issuing mask mandates or issuing recommendations. And I just wanted to ask you and hope that you could answer directly of if provinces who have dropped the mask mandate should bring it back.
Well, it's up to them, obviously. And the point I was trying to make is wear a mask anyways, whether the province is local jurisdictions recommending it or not, when the cases are rising and activities rising in your community. I think in general in Canada right now, all over the place, there's virus activity. So it's actually the risk assessment is relatively simple at this point in time. Provinces know their population better than I do as to whether it actually is more effective to use a mandate or not. Sometimes it makes things easier for people. It takes the guesswork out of the need for different settings to figure things out. But I think just as a general rule of thumb, wearing a mask is important right now.
Thank you. And my next question is about vaccine passports. And some of the vaccine passports that still exist, like the federal vaccine passport for travel on planes and trains, require that everybody needs 2 shots right now. But given what you're saying about the waning efficacy and your push for boosters today, would you like to see the definition of fully vaccinated changed so it requires everyone to have at least 3 shots?
Well, I think the message today is get up to date with your vaccination, which includes a booster for the eligible population. To all extents and purposes, that's 18 plus, and also can be offered to adolescents. So that is the most important message. I think and we want everybody to have had the opportunity to have had that 3rd dose, to be boosted, and some people who just got infected may need to wait another 3 months. So I think the discussions on whether the definition of up-to-date should be included in vaccine passes is an ongoing discussion. But right now, we just want to make sure everyone has the opportunity and the access to that important booster dose.
Next question is for Palak Manga.
Hi, Dr. Tam. Can you hear me okay?
Yes, I can. Thank you.
Hi, thanks for taking our questions. I just wanted to follow up also from some of my earlier colleagues around Paxlovid usage and uptake. It seems like the bottom line is provinces don't seem to be using the supply that they got from the feds, at least at the rate that some experts want to see so far. You did mention that we're seeing a greater severity, and from what I recall, we hope that Paxlovid would kind of help curb that. Can you speak to what might be hindering the I don't know if it's uptake or distribution to make it more widely available on the ground, and essentially what role maybe that 5-day period might be playing or might not be playing, and just what you're hearing from provincial colleagues on this.
Yes. So just to clarify your first point, is that, yes, we are seeing the uptick in hospitalizations, although not yet in ICU admissions. We hope that will stay down. And so Paxlovid is given to individuals at higher risk of severe outcomes when they just at the beginning of their illness, when their symptoms are still mild. And that's the time to take it, because you got to get the medication in, which cuts down on the viral replication and how it can multiply in your body. So you got to get that medication pretty fast. So that is a challenge. And that is a challenge, for example, when we are using influenza antivirals, is you have to get those antivirals provided at the early part of the illness. Sometimes people don't even know they're sick. They think they have allergies because it's spring. But if you're at a high risk, be hypervigilant that any symptoms could be COVID. And also, if you've been in contact with anyone else who has COVID, think of the possibility that you may have it. At that point, I am suggesting that people actually find out in your local community how you access Paxlovid, because it could be different in different areas. And you should know this ahead of time so that you can get into that window of opportunity. Then you need a test. It can be rapid test, it can be PCR, but you need a test to figure out you have COVID before you're given that Paxlovid. So the testing and the medication has to be linked in a very efficient way. So I think that's what jurisdictions are making sure that those pathways are clarified, and they're trying all different methods to try and make this work. So yes, I think all of us would like to see Paxlovid being mobilized more widely now that we have a significant amount of drug. So I think it's multiple factors. One is the public and those at high risk knowing that such a drug exists. So hopefully all of you can disseminate that message. Have them get prepared by finding out how to access that in your local vicinity, and talk to your doctor, because those at high risk generally have someone looking after them who can help them access it. And at the same time, as province and territories are trying to figure out the most efficient way to roll it out. But I think we need to keep at it. because we will be using these kind of medications in a more significant way as we have more access to antivirals in the future, which is great news. We just need to know how to get it out to people fast.
Yeah, thank you. And I guess just to follow up, at the same time, we're also seeing that some at-risk people are waiting for the treatment. And I know that you're sort of highlighting, as a time crunch here. You did also mention that we're expecting a resurgence in the fall, and that researchers are right now looking at the best practices for the deployment of this. How soon can some of these best practices for this treatment be, I guess, identified and followed, given we do have that sort of 5-day window? And essentially, what guarantees can you provide that that the provincial authorities will follow those best practices, or will it merely be optional advice or guidance?
Well, I think sharing best practices is very important, which is taking place with the chief medical officers. So I think in the next days, you'll hear about how provinces are expanding access. Quebec, for example, is trying to enable pharmacists. So in their context, they've worked out how to do that with the regulatory bodies of the medical professional colleges. This is medical practice. So how do you enable that to happen and enable pharmacists to be able to prescribe? And what are the supports to the pharmacists should they be doing that? And so all of that is being worked out in one jurisdiction. So that same kind of practice could be looked at by others, but the distribution mechanism could be different in a smaller community compared to a big city as well. So we will continue to share best practices, but I hope that what you will see in the next little while are jurisdictions able to communicate how they're doing that. They're working really hard, I know that, but we also need the public to be aware that the drug exists.
Next question is from David Thurton.
Hi, Dr. Tam. What can you tell us about the uptake for Novavax, and how popular has this alternative been so far? And was buying J&J a success in your point of view, or a failure?
So, first of all, I think it's incredible, and we're really fortunate in Canada to have access to the best vaccines, but also a range of them because of the investments we made at the beginning of the pandemic. You cannot tell at the beginning of this pandemic how the vaccines are going to be developed or how effective they were going to be. So we happen to have access to the best vaccines that we know, and also now have a choice for people should they not take the mRNA vaccine for whatever reason, even though they are, the benefits outweigh the risks. We keep trying to communicate that, and there's very good evidence that they work. So, but the J&J and the AstraZeneca and other vaccines have been provided just so that we can cover off anyone who isn't taking the mRNA vaccine. So investments in biomedical technology always carries a certain amount of risk, and that should be known to everyone, and you just don't know. And so I think we will continue to pursue the other technologies as well. As you know, there are other ones are still up and coming in the pipeline. And the reason is that even if they're not used now, what about into the future? What about in winter waves? How do what happens when you boost with those vaccines on top of the mRNA vaccine? All of those are very relevant technical and medical questions that still needs to be asked. The uptake of the Novavax vaccine, I can't give you an update at the moment. I think those are just beginning to be rolled out. So I think if you get back to our communications colleagues, we'll give you an update when we have those numbers.
Okay, I appreciate you saying when you don't know the answer to your question. That's always great. Well, not great to hear, but it's better than not answering the question. Okay, so but to that question though, like, is there any information though about the J&J vaccine in particular? Do you have a sense of whether, it has converted any vaccine holdouts? If there have been any success stories, or has it kind of just remained on the shelf and there's nothing really to speak of in terms of converting people who were vaccine hesitant? And also, in your point of view, like, do you think we need a specific Omicron vaccine, a vaccine that's made specifically to deal with Omicron and its various subvariants?
So the J&J, again, I think I will have to check into how many doses were given out, but we should actually have that information. But it will be a small number. But every individual who's vaccinated counts. And I thank those who access the J&J vaccine, but please do get your booster. And we recommend an mRNA boost because that has been proven to be the most effective approach. And you can give that mixed schedule. So if you had J&J, you can get that mRNA vaccine boost. And we have billions of doses of vaccine being provided in the world that has demonstrated the safety profile of these vaccines. So I think that number, I think, can be provided, but I think it would be a small number. And in terms of Omicron's specific strain, right now, all of the vaccines, of course, deployed across the world and certainly in Canada, focus on the ancestral strain. And vaccine manufacturers are right now testing the vaccine strain against the Omicron variant. So I hope to see some of those results in the next months. As to whether the results will be in time for the fall, for example, only time will tell. But they do have to be completed fairly quickly. And with, of course, good results for them to be deployed in that kind of time frame. I do think it's important to have a range of vaccine strains. I think that just keep boosting with the current strain is likely to be an interim measure. But I have to reiterate, 3 doses are important, even a 4th dose for the highest risk. And so far, this is the good news, so far for every variant from Alpha to Omicron, the vaccines have performed well against serious outcomes. So that's just something to remember. Maybe we don't need to change it, but I suspect that the trajectory forward is one where we do have to update our vaccine strains.
So I don't see any other raised hand, but we have still 5 minutes, so we might have time for one last question. So raise your hand if you have a question. Okay, so Dylan Robertson, go ahead.
Hi, Dr. Tam. I'm just looking back on the part about social cohesion because I don't quite understand. I mean, you're telling people to not harass people who choose to wear a mask. At the same time, you're saying that it provides, less guesswork if the provinces tell people to just wear a mask. You have less people, who have to justify it because they can say, look, I'm forced to. Like, I'm just trying to understand the social cohesion and the downside. I'm not advocating for a position, but I'm just trying to understand what the medical officers of health are thinking here in saying that, if we make this optional, it's better for social cohesion when we have people with disabilities saying they can't protect themselves anymore.
Well, I think as I've been trying to explain, this is a period of transition. It's not going to be easy. So that's the first thing to acknowledge. Different communities, not just at the provincial level, but the local level, know the community the most and what can continuously to bring people in a cohesive way instead of a divisive way. Wearing a mask and doing all the other things that protect each other is what we're trying to promote. If they see in the epidemiology, or if we have a variant that's really severe and highly transmissible, other public health measures may have to come back into play. So there is a balance, and they are trying to make that balance. It's not going to be that easy, and they will observe what happens as their policy has shifted. If necessary, I'm sure they will think about re-implementing measures, but that is up to them. I think at this moment in time is very important for us not to divide the population and keep messaging the need to protect each other. And so I think that's the most important thing. I'm not sure that's a satisfactory answer to your question, but I think that's what we're trying to say, is that we can't have too many of them and us. Is about working together. And yes, we need to advocate for those who are at the highest risk, so that others who are listening right now or come together and protect each other. And that's the right thing to do.
Okay, so I think this is all the time we have.
So thank you, Dr. Tam, for your time, and thanks everyone. Au revoir. Bonne journée.
Thank you, everyone. Have a safe weekend. Bye-bye.